Welcome everyone, Dylan Gemelli here today with a brand new video for you. So today we are going to talk about Nolvadex, also known as Tamoxifen citrate. Now, just as we always start off, I'm not a doctor, I'm just a guy that has done a lot of studying and a lot of learning over all of these years. I'm putting it all together, just giving you the facts and information that I've gathered. I'm not implying for you to do anything, use anything, any of the sort. All I'm doing is giving you educational information for your entertainment, and you do with it what you will. So, that being said, let's get into it. Now, the main medical use of Nolvadex is actually treatment of both early and advanced breast cancer in pre- and postmenopausal women. In addition, it's the most common treatment for male breast cancer as well, which obviously is not as common. Now, the FDA has approved Nolvadex for prevention of breast cancer in high-risk women with a recommended use set at 10 years. Yes, 10 years. And studies have shown that the chance of reoccurrence of cancer drops 66%. Another use for tamoxifen in women is infertility, as I discussed with clomid as well. Now, a recommended dosage for that is 10 to 40 milligrams per day during a woman's cycle, and studies have shown it possibly doubles the chance of pregnancy. Now, recently, Nolvadex is being used to treat bipolar disorders. Through the medical data on this, it's kind of still being investigated and debated, but they have actually been using it for that purpose as well in certain instances. Now, Nolvadex works very similarly to clomid. It's an antagonist of the estrogen receptors to which it binds itself, preventing active estrogen from binding in its place. Now, unlike aromatase inhibitors like Aromacin, Arimidex, Letrozole, for example, which actually reduce the flow of estrogen in the body, Nolvadex merely blocks estrogen from the receptor, so I basically deem it a suppressor, so to speak. This means there's a greater chance of estrogen rebound effect. Basically, what I always tell people, a lot of people will say, well, I'm taking this and it's shrinking things down, but as soon as I stop, it comes back. But that's because it's not killing off the estrogen. It's merely suppressing it for the time being. It's like a Band-Aid, kind of like when you get a cortisone shot and it relieves your pain, right then and there, but then ultimately it comes back and sometimes it's even worse. Well, that's what Nolvadex is doing. It's just Band-Aiding the wound in that regard. Now, let's talk about uses in bodybuilding. In the late 80s, there was a steroid guru that many of you have heard of named Dan Duchaine, and he speculated that Nolvadex could be used to help with gynecomastia. Since that time, it's become popular and widely used as an anti-gynecomastia treatment for on-cycle use with guys that are gynecomastia prone. Now, when gyno-prone anabolic steroid users run aromatizing compounds, things like testosterone, things like D-bol, for example, that convert to estrogen, all right, this can lead to puffy nipples, bloating, an increase in blood pressure, erectile dysfunction, and, even there can be some mental anguish there and problems as well that you have to keep in mind. Nolvadex can prevent some estrogen-related sides from occurring, and it can halt the growth of gynecomastia, but in my opinion, using an aromatase inhibitor is far more effective for estrogen control, and I personally have never told people, oh, just use Nolvadex on cycle. That's not something that I believe in, but hey, to each their own. I'm only here to teach you. So, in practice, tamoxifen is actually best used to boost your LH, which is your luteinizing hormone, and total testosterone. And this is going to help you recover from a cycle, which makes it a popular choice for post-cycle therapy. A clomiphene-tamoxifen combination is one of the best, recovery option combinations for post-cycle therapy regimens. I'll do a different video on full post-cycle therapy, but those two make up the main part of it, but on their own is not a complete post-cycle therapy. But like I said, that's for an entirely different video. So, how does it work for post-cycle therapy? When a user runs anabolic steroids, what happens? The pituitary realizes it's getting too much hormone, so it goes dormant. Okay? This sends your LH to near zero. Basically, it just bottoms out. And I'm sure many of you know that. But if you don't, you'll see it. And don't panic if you get blood work like 8 weeks into a cycle. This is what's going to happen. The body's going to no longer produce its own testosterone. So in simple terms, your natural testosterone production shuts down, or you'll hear that word suppression. When you come off a cycle, it's important to run a post-cycle therapy to help recover your body's HPTA. Now, tamoxifen does not mimic the LH in the body. Rather, it stimulates the hypophysis to release more gonadotropins. Gonadotropins are protein hormones that are secreted by the gonadotrope cells of the pituitary gland. And what happens from there? They stimulate faster, and then there's a higher release of follicle-stimulating hormone, which is your FSH, and your luteinizing hormone, which is your LH. Now, when this happens, the rise in LH will then spike up the total testosterone levels, allowing a smooth post-cycle therapy. As a result, this will help you minimize any losses in muscle gains until your body is able to recover. Now, tamoxifen works just like clomid by stopping estrogen from going into the pituitary, which manipulates it into producing LH. Now, in turn, it then signals the Leydig cells to produce testosterone. Many users of Nolvadex have run blood work showing LH levels rise from 0 to over 10 IUs, which is above the normal reference range for an adult male. Now, as a result of this, your testosterone levels are then going to go up as well. It's important to remember that testosterone spikes are temporary while you're using it. Once you come off, levels will then start to normalize, and with the foreign hormones out of your body, the user's HPTA will be able to recover then on its own. So, milligram for milligram, Nolvadex is actually stronger than clomid. Now, they're similar in that they're both SERMs and simply prevent the estrogen from binding to the receptors where it can cause a problem. Neither of these are aromatase inhibitors. All right, estrogen blocker is far different than aromatase inhibitor, but that's an entirely different video and topic. Now, in terms of bodybuilding, it's up to the user to decide which one they prefer. But through experience, my personal experience, what I've read and what I hear, it's much, much better to use them both during post-cycle therapy. Now let's talk about side effects and dosing. So, some users swear by Nolvadex, others swear against it and only use clomid and PCT. Some users complain about reduced libido, and others say that it increases their libido. I believe that the negativity with tamoxifen, from what I've seen, is misuse and improper dosing too high or too long. Now, you should start, the highest that I recommend is 40 milligrams, and then dropping down to 20 and sometimes even only 10. But you got to see what works best for you. It also depends on what kind of cycle you ran, the length, the compounds, all of that. They all play factors. So that's where it comes down to, A, understanding the compound itself and how it affects your body, all right, and B, running it properly in terms of what goes well with you and not abusing the doses. So, there is evidence that Nolvadex upregulates progestin receptors. So this means that if you run tamoxifen along with a progestin, something like, any type of nandrolone or trenbolone, you run possibly a higher chance of developing progestin-related side effects. Now, a lot of people say this is mythical. A lot of people say that that's bro science, that it's crazy, and then there's others that swear by it. Let me put it to you this way. I think there's some correlation there where you don't want to overdo it, like running Nolvadex on cycle. It's completely fine if you're running it in your post cycle after you're coming off DECA, NPP, Tren, or something. If you want to run it on cycle, which personally, I don't think you ever need to run Nolvadex on cycle. That's my opinion. I would just run it at a lower dose. I would just be careful and just keep a close eye on things. I think it's debatable on if it's going to blast your prolactin out of control. I've seen some crazy things said, but it's up to you. Just do it wisely and keep, your blood work and keep on it. So the half-life, it has a 6-day half-life because it shows between 5 and 7 days medically. So 6 days is the half-life on it as well. So that being said, www.icearms.com/forums. You can also get me on the Evolutionary Forum or the Elite Fitness Forum. On there at all times. Dylan@icearms.com is my email. Now, please make sure that you check the descriptions. You want to make sure that you read those because there's a lot of info there, my old videos, where to get me on social media, and little description about what you're watching as well. So make sure to read those as well. That being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.